In this video lesson, we'll be covering a nurse care plan for the nursing diagnosis of decreased cardiac output. We'll cover its definition, defining characteristics, related factors, expected outcomes, ongoing assessments, and therapeutic interventions. By the end of this session, you'll have a clear framework for managing decreased cardiac output. Decreased cardiac output is defined as an insufficient amount of blood being pumped by the heart to meet the body's metabolic demands. Common related factors are the following: myocardial infarction or ischemia, heart failure, arrhythmias for example, atrial fibrillation or bradycardia, fluid volume overload or deficit, structural heart conditions such as valvular disorders. Alright, now let's go over the defining characteristics, which are the following: hypotension or hypertension, fatigue or weakness, diminished peripheral pulses, dyspnea especially on exertion, decreased urine output, cool, clammy skin. Now, we will go over the common expected outcomes, which are the following. The patient will maintain adequate cardiac output, as evidenced by stable blood pressure, heart rate, and capillary refill time within normal limits. The patient will demonstrate improved activity tolerance, and the patient will verbalize understanding of the disease process and self-care measures. Okay, now let's go over ongoing assessments and why they are done, starting with the first one, which is to monitor vital signs, including blood pressure, heart rate, and oxygen saturation. Fluctuations in vital signs can indicate changes in cardiac output and the need for intervention. Next is to assess for signs of fluid overload or deficit, such as peripheral edema or dehydration. Fluid imbalances directly impact cardiac preload and afterload, influencing cardiac output. Next is to evaluate for symptoms of decreased perfusion, including altered mental status and diminished peripheral pulses. Early recognition of perfusion deficits can prevent further complications. Therapeutic interventions are the following: medication administration. This is done by administering the prescribed medications such as diuretics, beta blockers, or ACE inhibitors. Diuretics reduce fluid overload, beta blockers decrease heart rate and oxygen demand, and ACE inhibitors improve cardiac efficiency by reducing afterload. Positioning. Position the patient in semi-Fowler's position to enhance breathing and venous return. This position decreases preload and improves oxygenation by reducing pressure on the diaphragm. Activity management. This is done by encouraging rest periods and assist with activities of daily living, ADLs, to avoid overexertion. Reducing physical strain helps to conserve energy and prevent further cardiac workload. Okay, let's now discuss patient and caregiver education, which include the following: medication compliance. Teach the patient the importance of adhering to prescribed medications and recognizing potential side effects. Lifestyle modifications. Encourage a heart-healthy diet, low in sodium and rich in vegetables, and regular light exercise as tolerated. Symptom recognition. Educate the patient and caregivers on early signs of worsening cardiac output, such as weight gain, swelling, or increased shortness of breath. Evaluation includes the following: patient's vital signs remain stable and within target ranges. Patient demonstrates improved tolerance for activities without excessive fatigue or dyspnea. The patient and caregivers verbalize understanding of medications, lifestyle changes, and when to seek medical attention. This care plan provides a comprehensive framework for managing decreased cardiac output, focusing on proactive assessments, therapeutic interventions, and education to optimize patient outcomes. Well, that ends this video. If you found this video helpful, don't forget to leave a like, a comment, and subscribe for more nursing care plans and study tools.